everybody. My name is Mona Chisobo. I go by Mona. Today I'll be doing my Unit 1 journal video talking about my experience so far in psych mental health program. I've had experience in different settings, outpatient, inpatient, tele psych, and also I've been exposed to seeing patients across different age groups. I will talk about the adolescents, the elderly, the the children, also the young adults. So also during this period, I've managed different cases like anxiety, depressions, OCDs, ADHD, which is very rampant in young people. Sorry, with children, young people. I've also managed people with alcohol misuse, schizophrenia, paranoid patients, people with suicide. I've had experience, the diverse experience in psychiatry. So this is just like a handful of experience I've had so far during this clinical rotation. One of the reasons why I chose to work with this population of individuals is I have passion for psych. Right from time, I have this interest in psych because I feel like people with psych problems are neglected because people are so much interested about medical problems, surgical problems, neglecting the emotional, neglecting the psych, like psych aspect of an individual, which is very, very important. So this is the reason why I've chose this population of individual, and I still maintain my ground to continue with this population of individual. My concern during this clinical rotation is that I hope to be able to manage patients with complex psych needs. So this will help me to gain more confidence in future during the course of my practice or as a provider. So during this clinical rotation, I look towards managing patients with complex psych needs because I believe it's going to prepare me for the future. Talking about my academic goals and professional goals for this course, first of all, one of my very important goals is ability to improve on my diagnostic and pharmacological skills. I look towards being more proficient. I look towards being excellent in be able to diagnose psych patients and also deduce appropriate pharmacological intervention for them. Also, I look towards having solidifying my interpersonal relationship and also having good relationship, like developing an excellent relationship with other members of the healthcare teams. Also, I look towards my goals is ability. One of my individual slash academic goal is ability to deduce complex care plans for patients with complex psych needs. So talking about streamlining to my course goals for this section, I look towards being more proficient. I look towards being more confident with managing psych patients. Also, I look towards being more confident with psychotherapy medications, management of patients with psych medications. I look towards and developing my therapeutic relationship because I believe that therapeutic relationship is very, very important. It's very, very paramount in psych. Talking about my strengths and weaknesses, one of my strengths is that I'm a very, very efficient individual. I'm very, very empathic. I'm very detailed. I dot my I's. So these are my strengths. I'm also very time efficient. So talking about my weakness, I find it very difficult to delegate some work, delegate duties, which is something I've been working towards, like making sure that I delegate duties to subordinates or people around me. Thank you very much.